Hello, I'm Mommy, your nurse today. How are you?
Good.
We're going to close this curtain here, clean my hands. Can you verify your name and date of birth, please?
Maya Schultz, November 20th, 2011.
All right. So we're going to be checking out your heart today. Do you have any family history of any kind of heart problems?
No.
Are you having any trouble breathing, any shortness of breath?
No.
All right. So we start by palpating the carotid artery, one side at a time. So carotid artery is equal bilaterally, about 2+ on each. Then we take the bell of our stethoscope and listen to the carotid artery to listen for any bruits. So there's no bruits heard. So then we are going to inspect the chest. We're looking for any lifts or heaves. We're also looking at the apical impulse to make sure that to see if that is visualized. We would be doing this all on bare skin if this was in the real life situation. So after we inspect, we then are going to palpate. So we're going to put our hand to check for any pulsations. And then we're going to palpate the apical impulse, which is at the apex of the heart. We would do that for a full minute. We also would compare that to the radial pulse to make sure that they are the same. So we would count that for a full minute. Then we are going to move on to checking the valves of the heart. So we start at the aortic. Then we go to the pulmonic. Then we go down to the tricuspid. And then we go over to the mitral. So there we are listening for heart sounds S1 and 2, which are both heard. Okay, now we're gonna lay down on the couch here, so stand up. I want you to lay down on your left side. Okay, lay down, put this arm out like this, lay your head down. So we're gonna listen to the apical impulse while the patient is laying down, and then also feel the radial at the same time to make sure they're equal. And that's making sure there's no extra heart sounds, no S3 or S4. Okay, you can sit up now. We're going to go back and listen to the valves again because I forgot to switch and listen with the other side of the stethoscope. So we're going to listen to the aortic again, the pulmonic, the tricuspid, and the mitral. Okay, now I'm gonna have you lean forward a little bit, just like this, and we're gonna listen at the base of the heart for any aortic regurgitation. So lean forward. next we're gonna inspect the upper extremities, looking at color, noting any bruises, lesions. We're gonna check the temperature to make sure temperature is warm, skin is not dry. Then we also check skin turgor. This might hurt a little bit, so we pinch. So there's no tenting. We also look at the nail beds to make sure there's no clubbing. Okay, and then we're gonna palpate the pulses at the same time to make sure they're equal. So we start with the radial. Radial pulses are equal bilaterally at 2 plus, then we do the brachial. All right, and then we move on to the lower extremities. So we look for, again, any kind of bruising, masses, color change. We check temperature, make sure that skin is warm and moist. Then we will look at the feet. We will look in between the toes, noting any abnormalities. We look at the other foot. Temperature of feet is a lot cooler than the temperature of the legs. Do you have any pain in your feet at all?
No.
Okay, then we're going to look for edema. So we're going to press to make sure that there's no pitting. Okay, and then we're gonna feel pulses. So we do the popliteal behind the knee. And we do the posterior tibial. And then we do the dorsalis pedis. Okay, and then we also would check the femoral pulse as well. Okay, we are all done for today.